Miscarriage, also known as spontaneous abortion, refers to the loss of a pregnancy before the 20th week. It is a deeply personal and emotional experience for those going through it, often accompanied by physical symptoms that can be painful or alarming, like bleeding. Miscarriages are more common than many realize, affecting about 10 to 20% of known pregnancies. This number may actually be higher because many miscarriages occur before a woman even realizes she is pregnant. While miscarriages are emotionally challenging, it is important to understand that they are usually the result of factors beyond anyone's control and are not caused by everyday activities. Types of miscarriage. There are several types of miscarriage, each with its own characteristics and medical implications. Number 1. Threatened miscarriage. This type occurs when there is vaginal bleeding during early pregnancy, but the cervix remains closed. In this case, the pregnancy may still continue without further issues, but the bleeding could indicate a potential risk for miscarriage. Number 2. Inevitable miscarriage. This happens when there is bleeding along with an open cervix, which means the body is in the process of miscarrying and the pregnancy will not continue. In these cases, the miscarriage is already in motion and medical intervention might be necessary. Number 3. Complete miscarriage. This occurs when all the pregnancy tissue is expelled from the uterus. In this case, the bleeding and cramping stop once the process is complete, and no further medical treatment may be needed. Number 4. Incomplete miscarriage. This means that some pregnancy tissue remains in the uterus, leading to continued bleeding and possibly requiring a procedure to remove the remaining tissue to prevent complications, such as infection. Number 5. Missed miscarriage. This type happens when the fetus has stopped developing, but the body has not yet recognized the loss. This can occur without the typical symptoms of cramping or bleeding, and it is usually diagnosed during a routine ultrasound. Number 6. Recurrent miscarriage. This type refers to having 3 or more consecutive miscarriages. While this is rare, it can indicate an underlying medical condition that requires further investigation and treatment. Causes of miscarriage. Miscarriage can happen for various reasons, with some causes being better understood than others. Most commonly, miscarriage is caused by chromosomal abnormalities in the developing fetus. In fact, about 50% of all miscarriages are due to these genetic issues, which usually occur by chance as the embryo divides and grows. Chromosomal abnormalities prevent the embryo from developing normally, and the body naturally ends the pregnancy as a result. These abnormalities are not usually inherited, meaning they don't necessarily indicate a genetic problem with either parent. Rather, they happen spontaneously during fertilization or early development. The age of the mother is also a significant factor in miscarriage risk. Women over the age of 35 are more likely to experience miscarriage due to the increased likelihood of chromosomal abnormalities in their eggs. By the time a woman reaches 40, the risk of miscarriage rises to about 40%, and by age 45, it can be as high as 80%. Aside from chromosomal problems and age, several other factors can increase the risk of miscarriage. Maternal health conditions play a significant role in miscarriage risk. For instance, uncontrolled diabetes or thyroid issues can interfere with the body's ability to maintain a pregnancy. Autoimmune disorders like lupus can also lead to miscarriage because the body may mistakenly attack the developing embryo. Infections, such as rubella or cytomegalovirus, can also affect pregnancy, as can certain sexually transmitted infections like chlamydia and syphilis. Hormonal imbalances, particularly low levels of progesterone, can also contribute to miscarriage. Progesterone is a hormone that helps support the early stages of pregnancy by thickening the uterine lining, where the embryo implants and grows. If the body isn't producing enough progesterone, the pregnancy may fail to progress. Lifestyle factors, such as smoking, heavy alcohol use, and drug use, can increase the risk of miscarriage as well. Smoking can reduce oxygen supply to the fetus, alcohol can cause fetal developmental problems, and drug use can lead to pregnancy complications. Additionally, high levels of stress and excessive caffeine intake have been linked to increased miscarriage risks, although these factors are not always direct causes. Environmental factors, such as exposure to radiation, toxins, or certain chemicals can also contribute to miscarriage. For example, women working in environments with harmful substances like lead, mercury, or pesticides may be at higher risk of losing a pregnancy. Symptoms of miscarriage. Miscarriage symptoms can vary widely, depending on the type and stage of pregnancy. One of the most common symptoms is vaginal bleeding, which may range from light spotting to heavy bleeding with clots. The bleeding might be accompanied by cramping or abdominal pain, which can feel similar to menstrual cramps or labor contractions. Some people may also notice the passage of tissue or fluid from the vagina, which can be a clear sign that a miscarriage is occurring. However, it's important to note that not all bleeding during pregnancy leads to miscarriage. In some cases, spotting can occur in healthy pregnancies, especially in the early stages. Other symptoms can include a sudden decrease in pregnancy-related signs, such as nausea or breast tenderness. This could be a sign of a missed miscarriage, where the pregnancy has ended, but the body has not yet expelled the tissue. Some people may not experience any physical symptoms at all and only discover they have miscarried during a routine ultrasound or doctor's appointment. Diagnosis of miscarriage. When a woman experiences symptoms like bleeding or cramping, a doctor may perform a pelvic exam to check whether the cervix is dilating, which would indicate that a miscarriage is underway. Blood tests are often used to measure the levels of human chorionic gonadotropin, HCG, which is a hormone produced during pregnancy. In a healthy pregnancy, HCG levels should double every 48 to 72 hours in the early weeks. If HCG levels are not rising as expected, it might indicate a miscarriage. Ultrasound is one of the most common tools for diagnosing miscarriage. During an ultrasound, a doctor or technician uses sound waves to create images of the uterus and developing fetus. If the ultrasound shows that there is no fetal heartbeat or that the fetus has stopped developing, the doctor may confirm that a miscarriage has occurred. Treatment for miscarriage. In some cases, the body will naturally expel all the pregnancy tissue on its own, and no further treatment will be needed. However, in other cases, medical or surgical intervention may be required to ensure that all the tissue is removed to prevent complications like infection. For women experiencing a complete miscarriage, no additional treatment may be necessary. The body may naturally pass all the pregnancy tissue, and the bleeding and cramping will gradually stop. A follow-up appointment may be scheduled to ensure that the miscarriage is complete and that there are no complications. In cases of incomplete miscarriage, where some pregnancy tissue remains in the uterus, treatment options include medication or surgery. One common medication used is misoprostol, which helps the uterus contract and expel the remaining tissue. This is often used for people who prefer to avoid surgery or when the miscarriage occurs earlier in pregnancy. Surgical treatment for miscarriage typically involves a procedure known as dilation and curettage. During a D&C, the doctor dilates the cervix and uses a suction device or surgical instruments to remove any remaining pregnancy tissue from the uterus. This procedure is usually quick and has a low risk of complications. It is often used in cases of incomplete or missed miscarriage to prevent infection and ensure that the uterus is fully cleared. Prevention of miscarriage. In terms of prevention, not all miscarriages can be prevented, especially when they are due to chromosomal abnormalities. However, certain steps can help reduce the risk of miscarriage. Maintaining a healthy lifestyle is one of the most effective ways to lower miscarriage risk. This includes avoiding smoking, alcohol, and drugs, eating a balanced diet, managing stress, and getting regular exercise. Managing any underlying health conditions is also important. For women with chronic conditions like diabetes or thyroid disorders, working with a doctor to keep these conditions under control can help reduce the risk of miscarriage. If a woman has had multiple miscarriages, she may undergo testing to identify any underlying issues that could be contributing to pregnancy loss. In some cases, hormonal treatments or medications to support the pregnancy may be recommended. For those at risk of miscarriage due to progesterone deficiency, progesterone supplements may be prescribed to help maintain the pregnancy during the early stages. This can be particularly helpful for women who have experienced recurrent miscarriages due to low progesterone levels. Infection prevention is also key. Vaccinations, good hygiene, and avoiding undercooked meats or unpasteurized foods can reduce the risk of infection during pregnancy. Now, we want to hear from you. Have you or someone you know experienced a miscarriage? How did you find support during that time? And what advice would you give to others going through it? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.